The White House has signed off on a deal to purchase nearly 8.5 million rapid at-home coronavirus tests that people can take without a prescription. It's part of a $231 million contract with Australian company Ellume that will create a manufacturing facility here in the U.S. While new coronavirus cases appear to be on a downward trend, the U.S. recorded 95,000 deaths in January. That is the worst monthly total since the pandemic began. But deaths are expected to decrease this month. A number of new, highly contagious variants are still being detected across the country. However, experts say there is encouraging data on the effective vaccines against these strains, especially when it comes to preventing serious illness and death. CDC Director Dr. Rochelle Walensky addressed this earlier Monday.
People are saying, well, what are we going to do about the variants? And the truth is it's the same disease, right? We're going to do the same thing for the variants that we've been doing all along. The problem is that not everybody's doing it. I just looked at some data out of our 2 South Carolina variants. There were at least 15 contacts of people among both those variants, and masks were not worn at all. Everything that we should be doing for the disease, we should also be doing for the variants. We need to be really transparent about what the data show. And quite honestly, the outcome here that we're trying to avoid is death and hospitalization, and the vaccines that we're seeing work against those endpoints.
Dr. Julie Morita joins me now. She's the Executive Vice President of the Robert Wood Johnson Foundation and former Commissioner of the Chicago Health Department. She also served as a member of the Biden Transition Advisory Board. Dr. Morita, thanks very much for joining us. Help us understand the latest numbers. Up until recently, the reason for stay-at-home orders and masking orders seemed to be based upon infection rates. Does that metric of infection rates carry as much weight as it initially seemed to?
Hi, Elaine. Thanks for having me today. So I think it's really important. There's a number of metrics that we follow with any kind of infectious disease outbreak or pandemic. And numbers of cases are important metrics to follow, but it's also really important to follow things like hospitalization rates and death rates as well. And I think the reason that we're talking more about hospitalization rates and death rates right now is because the new vaccines that are becoming maybe presented to FDA for consideration and for approval, that they show the evidence that we have so far would suggest that they're highly effective at preventing hospitalization and death. And so that's why we're talking about that a little bit more.
Well, let's talk about these rapid at-home coronavirus tests. How will they work and when will they be widely available?
So there are some rapid tests that are available already. This particular product is one that can be used at home. And while the U.S. has purchased a number of millions of doses of the test kits to be available, they're not going to be available immediately. It looks like there'll be about 100,000 test kits available per month for the first part of this year. And then later to the end of this year, there'll be many more test kits that are available. The test kit can be done at home, though, so you don't really need a doctor prescription, a doctor order. You can just run the test kit itself by doing a nasal swab, putting some drops into a little device, and then it'll connect to your phone so you can actually see what your result is.
Wow, it's fascinating to hear about that technology being available. Well, new data from New York shows that white residents are receiving the vaccine at higher rates than Black and Latino New Yorkers. While 24% of residents are Black, they account for only 11% of the people vaccinated. What accounts, Doctor, for this disparity?
So I think that one of the things to keep in mind is that not all jurisdictions or states have an ability to capture doses that are administered by race or by ethnicity. And that's really critical information. So it's good that New York can actually report that information and share that they know what they know, because what that does is it helps us to actually respond and make sure the programming is actually reaching the right people. I think one of the challenges that many places are experiencing this year right now is that the ability to register or to make an appointment is difficult. You have to have high-speed internet. You might have to go in, drive a car to a place to get vaccinated. You might have to do it during work hours. And those things make it difficult for some groups to actually get the vaccine. And so it's really important to think about where the sites are located. Is it easy to make an appointment? Can you do it by phone? Are there groups that can actually help people register for the vaccine? And then are the sites available after hours or on weekends? So all those factors come into play in terms of who's getting vaccinated and who's not. But having the data is really, really important so that the programs can be adjusted and modified, and so the right people can get vaccinated early on.
I want to ask you about Chicago. Teachers there are threatening to strike after the Democratic mayor told them to return to classrooms by Monday. Mayor Lightfoot says the schools are in compliance with CDC guidelines as well as local health officials. Dr. Morita, how can we safely send teachers and students back to classrooms?
So we all want our children to be back in school because we know that their learning is better when they're in the school environment. But we also want children and the teachers to be safe and not to get sick with COVID. There was a recent study that was released by CDC last week that actually showed that in many places schools have reopened and have been successful in preventing transmission within the school setting. But it requires certain measures to be in place. So children have to be, and the teachers have to be wearing masks consistently. They have to be socially distant, so they have to be separated and not overcrowded in the schools. And appropriate ventilation has to be in place as well. So it is possible to open schools safely, but there have to be appropriate provisions in place to make sure that the teachers and the kids are safe.
Well, New York Governor Andrew Cuomo has outlined plans for New York City to reopen restaurants for indoor dining with limited capacity on Valentine's Day. Meanwhile, White House advisor Dr. Michael Osterholm is warning of additional lockdown measures. Which scenario do you see as more realistic?
So again, it's kind of like the balance with opening schools. It's really important for the economy, for our businesses to be open and restaurants to be open, but we have to do this safely. And so things to consider when mayors or governors are considering whether to reopen are how much disease is actually circulating in a community, how prevalent is the disease, but also can you open up your facilities, your restaurants, your bars, that kind of thing, and limit capacity? And will people comply with the other measures, whether it's washing hands or wearing masks, so that it can be done safely? So again, it's really a balance of trying to open up the economy, but also making sure the appropriate protections are in place so that it can be done safely, and always keeping in mind how much disease is actually circulating. So when community disease rates are lower, the risk of transmission is lower, and these things can be considered, and restaurants could reopen, but again, with the appropriate protections in place.
Well, on Face the Nation Sunday, former FDA Commissioner Dr. Scott Gottlieb predicted there will be more regionalized epidemics in places like Southern California and South Florida due to the spread of the new coronavirus variants. What are your thoughts on that?
So I think the key thing is that we know that we have systems in place to detect that the variants are here, and we have identified various variants within the United States. What we know is that they seem to be more easily transmissible. And so we could see higher rates of disease in those places where the variants have been detected. But the key thing we also know is that if we wear masks, if we keep distance from 6 feet apart from people, if we don't go into crowded gatherings, we wash our hands regularly, all those things can help us prevent transmission, whether it's the variant or the original form of the virus. And so people really need to continue to use those appropriate measures while they're waiting to get vaccinated. We all want to get vaccinated, but the vaccine still is in short supply. And so while we're waiting, wearing your mask, socially distancing, all those things are really critically important.
A message that bears repeating. All right, Dr. Julie Morita. Doctor, thank you very much.
Thank you.